Welcome to Addiction, Mental Health, and You, a six-part education series. You may be wondering, what is this all about? Why do I need to sit in front of a computer to watch videos about addiction and mental health? Well, let's explore that a little bit. Let's take just a moment to review what you will be learning about in this series. Each module will provide important, life-improving, and in some cases, life-saving information that you can then share with your colleagues and family. On this slide is a list of the topics each module will cover. At the end of each module, you will complete an assessment to evaluate your learning. After you finish each module, be sure to check in with your HR representative for the assessment. Module 1, Physical and Mental Health Impacts Related to Drug Use. Drug use can have a wide range of short and long-term, direct and indirect effects. These effects often depend on the specific drug or drugs used, how they are taken, how much is taken, the person's health, and other factors. Short-term effects can range from changes in appetite, wakefulness, heart rate, blood pressure, and/or mood, to even heart attack, stroke, psychosis, overdose, and death. These health effects may occur after just one use. Longer-term effects can include heart or lung disease, cancer, mental illness, HIV or AIDS, hepatitis, and other diseases. Long-term drug use can also lead to addiction. Drug addiction is a chronic brain disorder. Not everyone who uses drugs will become addicted, but for some, drug use can change how certain brain circuits work. These brain changes interfere with how people experience normal pleasures in life, such as food and sex, their ability to control their stress level, their decision making, and their ability to learn and remember. These changes make it much more difficult for someone to stop taking the drug, even when it's having negative effects on their life and they want to quit. Drugs can also have indirect effects on both the people who are taking drugs and on those around them. This can include affecting a person's nutrition, sleep, decision-making, and impulsivity, and also increases the risk for trauma, violence, injury, and communicable diseases. Drugs can also affect babies born to women who use drugs while pregnant. Broader negative outcomes may be seen in the education level, employment, housing, relationships, and criminal justice involvement. Watch the following video clip to learn more about the impacts of substance use and misuse on the mind and body. Mental health means different things to different people. You may think of control, happiness, contentment, and order, but good mental health is usually a sign of a positive way of life. Mental ill health is the opposite of this. It causes problems and creates barriers to being happy. Your frame of mind may vary between the two as mental health can change. It can be affected by external influences, and one of these is drugs. Drugs that are psychoactive, such as cannabis, alcohol, ecstasy, and heroin, have the ability to affect your mood. They can arouse certain emotions or dampen down others. This may be why you use them. The changes in your mood or behavior caused by drugs are the result of the changes in your brain. This is also the part that controls your mental health. Drugs interfere with those chemicals in your brain. This affects the messages those chemicals are trying to send. You need to weigh up both the short-term and long-term effects that drugs can have on your mental health. The short-term effects may well be something you enjoy, but probably only if they happen like you expect them to. You may also have unwanted short-term drug-induced side effects, such as acting or feeling strange. But these short-term effects leave because they disappear as the drug passes your system. But drugs can also have longer lasting impact on your mental health too, and you need to think seriously about your own strengths and vulnerabilities. Consider whether you use drugs to make bad feelings go away and whether you are in control of your use. Even if you start using drugs with a clear mind, they may still affect your mental health. Drugs can simply expose bad feelings you never knew you had. Unwanted effects may stay with you because you have a pre-existing mental health condition you were not aware of, or you may get the dose very wrong and permanently disrupt the chemical balance in your brain. Now you want to make sure you have your pencil and paper handy. We're going to go over a few notes in the next few slides that are pretty important. All psychoactive drugs may cause mental health problems while you're taking them, and those problems may continue to exist as the drug clears from your body. These can include things like anxiety, mood swings, depression, sleep problems, and psychosis. Let's talk about a few of those. Drug-induced anxiety disorder. You may have panic attacks, periods of very severe anxiety when your heart rate increases, with trembling, sweats, shortness of breath, and a fear of losing control. You may also feel like your surroundings are strange and unreal, or that you are losing your personal identity and sense of reality. Drug-induced psychosis. Psychoactive drugs can cause delusions where you believe things that aren't true, or hallucinations where you see or hear things that are not there. And finally, drug-induced mood disorder. You may have times when you feel depressed, such as sad, restless, irritable, tired, loss of pleasure, or manic, or an elevated mood with delusions, impulsive behavior, and racing thoughts. This is called mood disorder and may be caused by drugs such as cocaine, amphetamines, heroin, and even methadone. Psychoactive drugs may cause you ongoing or longer-term mental health problems. It's not clear why this happens to some people and not to others, but it may be that using a drug has triggered a mental illness you didn't know you had, or the drug changes the way a certain chemical affects your brain functions. Here are some of the ways that different drugs can affect your mental health. Ecstasy and depression. Ecstasy is an amphetamine that causes hallucinations. It works by making serotonin more available and gives you a sense of euphoria when you take it. Serotonin is a chemical naturally found in your brain which regulates your mood. It is sometimes called the happy hormone. Ecstasy causes your brain to release a much higher amount of serotonin than usual. Over time, your natural stores of serotonin may drop so much that you may never have the same levels you had before you started using the drug. If lots of serotonin means euphoria, then lack of serotonin means depression. You may experience short-term depression in the days after you use ecstasy, but we still need more research to learn about its longer-term effects. Marijuana and schizophrenia. Schizophrenia is a severe mental illness which may cause you to hear voices in your head and believe that other people are trying to control or harm you. Research shows a link between marijuana use and people with schizophrenia. It is possible that if you have a pre-existing risk which you may not be aware of, there is a higher chance that using marijuana will trigger an episode of schizophrenia. These risks are also greater in younger people who use marijuana and those that smoke it more regularly. Using marijuana as a teenager may be a risk to many aspects of your mental health. One of the compounds in marijuana, called THC, also known as tetrahydrocannabinoid, is what makes the high in marijuana. THC is very similar to endocannabinoids, which are naturally found in your brain. These regulate other chemicals that control many aspects of your brain function and behavior. Because THC is so similar, it can mimic the effects of these natural compounds and take over these aspects of your brain function. The long-term effects of using marijuana in your teens may be caused by the influence of THC on your brain's chemical systems at a time when your brain is still developing. Well, that wraps up Module 1. Be sure to review your notes because at the completion of all 6 modules in this series, you'll take a test to cover the contents. Coming up is Module 2, where we'll cover the financial and legal implications of alcohol and substance use.